Hospital CEO of St Helena, Dr. Steve Herber, and we're doing an update on our COVID-19. Steve, Dr. Herber. I am so grateful that you are here with us, and I see your mask. Can you tell me a little bit about what you're wearing?
So this is my new daily uniform. So now I can take it off. We are requiring masking for all of our associates, team members, and any guests and patients coming in. And it's a safety thing. So I'm delighted to join you, Pastor Josie, to give all of the family of our church an update of what's going on here and kind of what's going on in the world around us, and answer questions that I know you've been collecting.
That's right. Well, the last time we talked was about 5 weeks ago. And I just wanted to hear, that was before we had any cases in the county. And so I'm just hoping that you could give us an update as to where we are right now in our county, in the Up Valley.
I would love to do that. So in some ways, 5 weeks feels like it's been very short. In some ways, it feels like it's been a lifetime. So living with this evolving pandemic has been a bit stressful. It's been a little surprising and uncertain, but a lot has happened in the last 5 weeks. So I want to just give all of you a little update on what's happened here in Napa County and at our hospital. The main thing is we eventually got cases. Amazingly, we're up to probably the low 60s now that have tested positive here in Napa County, including 2 younger people, 2 under the age of 18, which was something new for us. And part of the reason the numbers are low is, as you've all heard, testing all throughout the country has been limited by supplies and ability to do tests. So when we last spoke, we were having to send tests out either to the county, and they had a facility that would do the testing and get the results back. And that could take as long as 5 days sometimes. And then there's a reference lab that we use called Quest Lab. And that was taking anywhere between 48 hours and 2 weeks sometimes because of the demand. So
is it still taking
a long time to get the results. Since we last spoke, the hospital now has in-house testing. We have capability of doing, we are allotted 96 test kits a week, and we have not needed to use that. And part of that is because we're being very selective about who can have a test. You have to meet certain criteria and have symptoms because this is a precious resource. So we are doing testing. We have had some positive tests, but they've been those that were in the community and not so ill that they needed hospitalization. So up to this point, we have not had or treated a COVID positive patient in St Helena Hospital. We're ready for a surge. We've been doing a lot of preparations. And so that's kind of where we are as a hospital. The other things that have changed, as we realize that in these 5 weeks, we agreed to reschedule surgeries that are known as elective. They're scheduled procedures and surgeries that aren't urgent. And just because we didn't know what was going to happen with COVID infections, we made the voluntary move of rescheduling those things. So just this last Monday, as you might imagine, that is very impactful into the rhythm and life of a hospital. And we do a lot of procedures. We do several hundred a month when you GI procedures and cath lab procedures and surgeries in the OR and minor procedures. So to not do that anymore has a huge financial impact to healthcare in general, not just our hospital, but all hospitals. And we haven't needed as many staff. And so people have been using up their vacation time because they haven't been able to work. And so this is part of what you hear causing the big impact in healthcare organizations all over this country. They have all voluntarily suspended temporarily some of these things. And so I'm happy to announce that the fact that we hadn't had patients with a COVID infection Napa County seems to be doing a very good job of the social distancing, the shelter in place. And so that has kept us from having these cases grow so rapidly. And so that means the condition that we were trying to aspire to is suppressing the curve. And you've heard that talked about. Looks like Napa County has successfully done that. And so now what that does is it means the surge won't be as dramatic. It won't overwhelm our healthcare resources like happened in the state of New York, where you hear the horror stories of, just patients in the hallways and in special hospitals they've set up and convention centers. That probably won't happen in Napa County. We don't know for sure, but if a surge happens, it won't be as high and it will be later. So with that in mind, we started relaxing our restrictions this week. And so we performed 30 surgeries this week, whereas the week before we did about 7. And so these are patients that have been really needing some care, but we had put it off. And so now we realize we can safely care for the patients. We're not compromising on our readiness. We have some great plans in place, and we have accumulated some personal protective equipment and masks, and we're able to be ready in case something arises. But at this point, we're starting to expand what we can do for our community. And what I tell all our team is we're kind of inviting patients to come back. I think people have been afraid of, and rightly so. You hear the terrible things happening elsewhere in the country and how serious this infection has been. And so people have been afraid to come to a hospital because they said, well, that's where the infected patients are. That's not true with us. And think of hospitals. We've dealt with a variety of different infections forever, and we know how to safely do that. We have isolation rooms. We have ways to keep patients and visitors safe, even if we did have an infected patient.
That's really helpful to remember, that hospitals deal with very contagious people, very sick people on a regular basis. Like, that's just a very helpful reminder.
Yeah. So our message is we're here to take care of you if you need us. You don't need to be afraid to come in. We have procedures for if somebody has a fever, they have some symptoms that we're worried they might have this infection. We can now do the testing and within an hour find out the facts about that and then treat them appropriately. But we have a separate way to come into the emergency room, right into a special isolation room that keeps them safe and our team safe. And then we can find out. We have special places in the hospital to care for patients if they need hospitalization, if they were infected. And so the rest of the hospital is very safe for those who don't have that infection, but they might have routine conditions like appendicitis or things that are really important to take care of. But we want people to know, don't stay home if you're having symptoms of chest pain or things that you normally would come to the hospital for. It's safe to come and let us check you out and make sure you're okay. So we're inviting patients back now. And I think that'll take some time to have everybody get used to the idea this pandemic can be going on and we can get back to a more normal life. So that was kind of the summary of what I wanted to share. And I know you have some good questions that probably a lot of our viewers have. And so I'd love to answer those.
Yeah, and I just want to thank you for the update and for taking the time to do this. I know that with everything going on, you have so much happening, and so thank you for this. I have some questions. They're written out, and they're all mainly follow-up questions from our last time that we had an interview. For example, one of the things that you mentioned was for people who have symptoms but may not necessarily need immediate hospitalization, that there may be drive-through testing. Has any of that happened in Napa County?
Yes, I'm glad you asked. And many of you may have received a Nixle alert on your device yesterday, and that's what it's about. So the county had a drive-up site way down by the DMV and where the county offices were in South Napa, and they're discontinuing that now. there is a new program that was starting today to do a 3-hour pilot, and it's starting in earnest on Monday. And there's a group, a nonprofit group that was actually founded by the actor Sean Penn, and they have come to the community of Napa with a lot of volunteers, and they have funding from the governor's office, and they're going to really expand what's available for testing. So their goal is that we get some answers about how widespread the virus may really be in Napa County. The county over the last 5 weeks had done less than 300 tests total, because we had very, very strict guidelines for who was eligible for a test, because we didn't have a lot of tests and the hospitals didn't have testing. So we haven't tested that many people. So the goal for this drive-through testing, and it's going to happen at the Napa Valley Expo, and there was some information, a link on the Nixle alert and on Napa County Health and Human Services. You can kind of find this out, but it's at the Napa Valley Expo. And so there is a way to register, and it'll have some questions, but this is a much more expanded indications. And so they're wanting to test some high risk populations, like people who might live in a communal dorm-like atmosphere, or homes where there might be many people in one home, and that's a higher risk. If somebody got infected, it could really spread. So they've got a lot of indications, not just your health, not just health questions, but kind of your living circumstances. And so they're hoping to do over 200 tests a day, which is almost what we've done in the last 5 weeks. And so it is drive-through. They have people there ready. They have plenty of testing capability, and you register online, and then there's a way for you to get the results. That turnaround time is about 2 days, but they will get those results to people directly who have this testing done. So that is something new that's just starting, and it's a great resource. And the governor is really trying to set up these. I think there's going to be 20 some locations through the state, and Napa County is one of these.
Wow.
So that's good news. We also have some testing available at Queen of the Valley. They don't have quite as many tests available a day as we do at St Helena, Adventist Health St Helena, but we're still using those. Our priorities are for patients that come to us that may be sick with the virus. We want to test them. Some of our healthcare workers, and we did have a few people that worked in our clinics, one of our clinics, that were exposed. None of our patients tested positive, but there were, and I talked to one of the managers of a clinic. She had the illness, and she didn't get sick at all. She just had a bad headache. She tested positive, and we've now proven that she's recovered from that. She's testing negative, and she's back at work. But it just shows that, there's some people that may not have very many symptoms, but we're using our capacity, if we have any worry at all, with part of our provider team, because we want our patients to know they're safe. That's another thing. I think one of your questions is about this, but we'll talk about the masks and what purpose they serve in a minute. But that is also why we want to use the best practices to just keep people safe when they come to see us, and we're using our testing capability wisely.
Yeah, I mean, now's a great time to ask that question. Why do we wear masks? Why do you wear masks? I mean, when we go to the grocery store, we see people with masks, and walking around, we see people with masks if you want to get fast food. Why do they wear it?
So first of all, that social distancing, that magic 2 meters or just over 6 feet, that's about believing that this virus is spread through droplets. And so if you think about when people cough or sneeze, there are little fluid droplets that go through the air. If you're wearing a mask, a cloth face covering, and you've really heard it emphasized both at our national level and in our state level, that these kind of masks are meant for healthcare providers. We provide them for patients that come in too, because we can get these. But a cloth face covering is going to prevent that liquid from traveling where somebody else might inhale it. And that's really what we're trying to protect others And you may not even know you were sick. And then if all of a sudden you sneezed and you're in the market, you're more likely to spread it. So this is a way we can protect each other, but it's not so much to protect us. So if I go to the market wearing a face covering, it's mainly to protect other people. It's not that I'm so protected. Now, I could have protection if I wore an N95 mask, but we're supposed to conserve those for when we're caring for an infected patient and they have a really tight seal around the edges and they filter out 95% of particulate matter. That's really when you would be wearing it as a healthcare provider to be protected from someone who's infected. But the face coverings are really something just to prevent the spread between us and others that we might be fairly close to. And another question that came up is, how long do we need to do this?
Yeah.
And until we know that we have enough immunity in the community, and there are many of us who haven't been exposed and are still at risk, I think the guidance is going to be that for months, we're probably going to say that that's the safe way to live. So if any of our viewers want to start getting pretty material, I think this is going to be a real growth opportunity, a fundraiser for the Haven. We could start selling masks with our logo on it or something like that. I think this is going to be with us for a while, Josie.
Yeah, I was just hearing that there may be a possibility of some form of social distancing until 2022. Now that's almost 2 years from now. What have you heard about that? And because I know you're in more meetings than the general public gets access to.
Well, that's definitely a guess, but what that probably correlates to is there are those who feel like until we have a reliable vaccine for this virus, it's probably still some level of danger. And the way we can protect ourselves is some of the basics: social distancing, face coverings, really attentively washing our hands. And when soap and water isn't available, having the hand sanitizer. So I think we're going to really we're going to get in a new habit. And this is going to change our routine and it's going to become the new normal. I don't know if 2022 is the right number, but I think we need to just reconcile ourselves to saying we're going to commit to some of these behaviors because it keeps us and those we care about safe.
Yeah. Well, that's helpful because there's some people that are still saying, okay, maybe tomorrow it'll be over, or maybe next week it'll be over. And so what this is saying is, well, we may not be able to say it's going to last all the way to 2022, but it may not be over in a week or in a month.
Yeah, I think that that's right. And we're going to see as we open things up. And I keep thinking of, you're leading me to your next question without asking it. So it's like, when will we get back toward normal? And so one of the things that came out yesterday was new guidance for our shelter in place. And so the modifications didn't seem like that much, but it's recognizing that all of us are feeling really cooped up. And so what could we safely do? So there was some guidance on construction workers were okay to go out, and real estate agents if they social distance and have face coverings, and it's okay to golf, but it's not okay to play cornhole or bocce. So these are all about, are you likely to have a contact with something that could spread on a surface? Are you able to stay at a distance from people so that it's safe and it's more like a form of exercise? Like, I love to ride my bike and I'm not close to anybody, and there's so much air outside that I'm unlikely to see, catch a floating particle of virus, and it's very low risk to ride my bike without a face covering. So golf is similar. And so our county health officer is very conscientious, and she's monitoring everything in our community. And as soon as we can safely restore activities, she's committed to doing that. So I'm really happy with how things are going. I don't want somebody to be over aggressive. I hear about other states that are just tired of being constrained, and so they're opening everything. I think they're going to see another surge, and unfortunately, I worry that some lives are going to be lost because people were too hasty. I hope that's not true, but I appreciate that I live in an area where people are being thoughtful about it and not over quick to open things up and then have us experience more infections. So I'm content to be patient because I think it's saving lives.
Yeah. If we think about, I know that there there is, with flattening the curve, that means that we reach our peak a little bit later. I've heard that in Napa County, it could be the end of April, beginning of May, reaching peak. So this is a twofold question. With the conversations that you're having, when are you expecting or hearing that we may possibly be reaching our peak? And then the second question is, what does that mean?
So great questions. Um, they're using some mathematical modeling for this. And there's a model out of Johns Hopkins, there's one out of Stanford, the University of Pennsylvania has one. None of these models agree. So I think it's really unlikely that we're going to see a surge or a big peak in May. It just doesn't look like we're seeing that. I think our social distancing has really flattened the curve, as we say. But what that means is it's pushing it out. So there could be an increase, and that is more likely to happen towards summer. And we don't know exactly. And there are some of the models that say we've done such a good job, we might not have a surge at all. Or just we'll see some cases here and there. If you think about it, if this was shared between people very at low levels, but for a long period of time, our hospitals are set to take care of these patients. We have plenty of capacity. It's if that happened pretty rapidly, like say, for example, that PUC was in session and the students are all mingling in the dining commons. They did nothing. And one student brought in the virus, and then it was spread to 4 others, and they had 4 others. Pretty soon we could have 2,000 people that were sick. That would be a surge that would overwhelm the hospital capacity in Napa County. That's why keeping the students home, doing the virtual learning, doing the same in all our schools, we're just avoiding those situations where the virus could get spread very quickly and create this big peak that would overwhelm our resources. So it's a sacrifice we're making. It is really getting to feel oppressive, but it is so worth it because we are able to care for these things as they're happening at a lower level. And so I'm very thankful that we've done that, and I'm hoping we can maintain that and kind of adjust to a new way of being so we don't spread this until we can be protected by a vaccine or something.
Yeah, and you were talking a little bit about keeping the students home, and so that just reminded me of another question that has to do with what age range of the population is showing up with symptoms of the virus. You just said that there were 2 cases that were under the age of 18. What does that say about, because earlier in our first interview, we were thinking about those who are 60 and older. Are we still seeing that they are the most vulnerable?
Yes, so those higher age are more vulnerable. Their immune system isn't going to be as nimble. That's why we've heard these terrible stories about the perfect storm of older individuals and living in a communal setting. That's the other thing about this testing. So we're worried about like the Adventist retirement estates in Yountville and the veterans home. And so one of the things this core group is going to do is some mobile testing where they'll go, and more than testing the residents, you want to test the workers that are coming in and interacting. So if I was working in a retirement home or a senior living setting, and I went from person to person, I had some role where I'm interacting with a lot of people and I didn't realize it, but I was contagious.
Yeah.
That could be devastating in a population like that. So we've been trying to keep those populations safe and really monitoring the health of those working there. But they're going to test those workers, not so much the people living there, but the people coming in to make sure they don't have the virus to spread it. But because we've taken those measures to protect the more vulnerable populations, what's been showing up is the age 18 to 40 or 50 is most of the positive tests. And this is a new finding this week to have some younger individuals that were symptomatic enough to merit testing. And as we expand these criteria, we may see that age range branch out. We might find more positives than we knew about in our community. That's the value of doing that testing.
Wow.
Another type of testing is the serologic testing that will tell us who has had the infection and recovered and has antibodies. And that's something that's not here yet. Our system, I just learned today on a call that I had with our system leadership that we hope to have.
When you say system, you mean
Adventist Health System. Adventist Health in our 22 hospitals will have available this serologic testing that allows us to check on who might have had this. And if somebody has antibodies, we'll know they're safe to care for COVID patients and not likely to get infected. And that is the kind of testing that lets you know how widely exposed a community is. And that also guides relaxing some of these shelter in place requirements.
So one more question. If I am in a living situation where I'm living with my family, maybe there's 2, 3, 4 people in the house, and one of my family members is diagnosed with COVID-19. So I know that the county closely monitors family members, but what does that mean about how my life should change, even though I'm not the one that's been diagnosed?
So that's a great question. So typically we've kind of quarantined the whole family. With more expanded testing, we could probably test some, I would sort of separate the person with the known infection, positive test. We shouldn't have people from that family unit going out, unless they were tested, we know they're not positive. We wouldn't want to be spreading it. So with more testing available, that could be done, and there could be some separation. But it's kind of a quarantine of family unit. What is considered a significant exposure is more than a 15 to 30 minutes in close contact with somebody. And if you're eating around the same table and you're not wearing masks, then everybody's at risk to contract this. And so we want to be careful with that whole family unit because there could be the ability to spread. And now that we have more testing, we could maybe check that. In some cases, when people have the luxury of, a granny unit on, you might separate the family. In Southern California, I've heard of healthcare workers that have been exposed and they're staying in a hotel, which is not taking care of people, to protect their family for a period of quarantine. So there are a lot of strategies being used, but we'd want to be really cautious about certain family members going out and about when we know that there's infection in the home.
Yeah. Do you have any you have given us so much information. I'm glad this is recorded because I think I'm going to go back and re-listen to some of this stuff. And it's been so helpful to talk to you. Do you have any words of hope for us? And I have one more question after this, but any words of hope, for us? Like, how can we reframe this as we are living our daily lives in such different ways?
Well, I don't want to take this lightly because we have seen its devastating effect. And in certain individuals, it has some devastating impact. So this is a very serious thing and we're not through this yet. But I think we're learning how to do some smart things. And, we're blessed to live in a beautiful area. We can get out and do activities, and we need to work on our own personal resilience and not be too stressed by this, but we also need to not relax our guard and give up hand washing and face coverings. And so we're going to have to live through this for a while. What I think I'd like everybody to think about is how we care for each other. We have, we have a couple of, an older couple, and then a lady who lives alone that just don't have access to get their provisions. And so that's something that we've taken on. This is a time where we can really show what we're about as Seventh-day Adventists and as members of the Haven, and look for the opportunity to care for each other and care for our community. And I think that will give us purpose and resilience, and could be a wonderful thing to come out of this time that's scary and uncertain.
Yeah. Now, a personal question. Can you tell us a little bit about that amazing photo right behind you? Where'd
So
you
that's
get
a painting by our now mayor of St Helena. I was attending an event, a fundraiser, and that was auctioned, and I just loved the colors. It's
Yeah.
kind of whimsical. It's depicting the canals in Venice, and the gondolier is an elephant. So inspiration for a children's book, and it became a painting, and it cheers me up. So
well, thank you. And thank you again for your time. And we will hopefully hear from you and get another update from you. Thank you. We're so glad that you're a part of our church family as well.
thank
All right.
you, Lucy. Happy Sabbath, everybody.
Bye.